Hi, my name is Dr. Jenna Koschnitzky, and today I'm going to talk about Ependyma. So you might ask, why do we care about Ependyma? What are they? What do they have to do with hydrocephalus? Well, the Ependyma are cells that actually line the ventricles, and they create a barrier between the brain and the CSF. And so this barrier is important because it actually controls what passes from the brain to the CSF and from the CSF to the brain. So you can imagine that your brain is hard at work. It needs a lot of nutrients, it needs a lot of energy, but it also is creating a lot of waste. And so what you have is a system where in an organized manner, through the ependymal layer, you have nutrients from the CSF going into the brain. You also have waste from the brain going back into the CSF and then being removed from your body. So this is a barrier that's important for brain function and for brain health. What's also interesting is that during development, the area right around the ventricles is called the subventricular zone and ventricular zone. And in these two zones, there are cells, such as stem cells, that really help create the rest of your brain. And so you can see over time in babies or in utero that stem cells divide and turn into different types of cells in your brain, and they actually then move to the appropriate place in the brain. When you start disrupting the layer, those ependymal cells and that ventricular and subventricular zones, you can actually affect how the brain develops. So why is this important for hydrocephalus, and what research is currently out there? Well, we know that in some cases in humans of congenital hydrocephalus, you actually have those ependymal cells that I remember usually held together pretty tightly, actually breaking apart and falling into the CSF. And this leaves gaps in that layer where suddenly now you have CSF in direct contact with brain tissue and with those ventricular and subventricular zones. We also see similar things happening in post-hemorrhagic hydrocephalus of prematurity. And there's some evidence in post-infectious hydrocephalus that this is also happening. So you can see that disruption or damage to those ependymal cells can be important in hydrocephalus. But now, why are they important? So one idea, is that as the ventricles are expanding, it strains the connections between the cells. And that strain or that enlargement of the ventricles is creating damage, and those cells are falling in. Another idea, however, is that the junctions or the connections between the ependymal cells are actually weak in people that end up developing hydrocephalus. And so it perhaps is that weakness and even maybe more normal CSF pressure that is actually creating an environment where the ependymal cells are not strong enough and they're falling off, and then allowing the ventricles to expand when the pressure increases maybe more easily. So it's an area of really active research and a very interesting topic. What's great is that there are actually molecules that researchers are now trying to use to strengthen those connections or make new connections between the ependymal cells. And when you strengthen those cells in animal models, you can actually see improvements in outcomes related to hydrocephalus. Now, again, that's really early preclinical research, so it's not in clinical practice yet and has a long way to go, but it's a new sort of therapeutic target that researchers can start exploring now. In addition, I mentioned that as the ependymal cells actually fall off, they create these gaps in the ependymal barrier. And so now suddenly you have CSF in direct contact with the brain. Well, what we end up seeing then is that to fill those gaps, new ependymal cells don't really come into play, but astrocytes or scar tissue do. So you end up having an ependymal layer that has patches of scar tissue instead of a functioning ependymal cell. And you can imagine that scar tissue and ependyma actually work quite differently. So we recently funded a study out of Greece that's looking to actually change those astrocytes to reprogram them back into functioning ependymal cells. And so it's a type of cell therapy where instead of trying to replace the cells, you're actually trying to say what's there, and in this case that's scar tissue. What do we need? Ependymal cells. And how do we get there? And so there's actually ways to reprogram cells to turn into what you need. This is happening in a couple of animal models, again, of hydrocephalus, so we'll see where the research takes us in the next few years. But again, a really exciting area of research that has a lot of going on in it. So I hope you enjoyed this little talk about the ependyma and why they're important in hydrocephalus. Hopefully you join us next month when we take on the topic of cilia, which are connected to the ependyma, and how they may be affected in hydrocephalus. Thanks so much and have a great one.